Hello, everyone, and welcome to Time with Dr. O. Today, I'll be talking about a topic that is so dear to my heart, being a fertility consultant, and that is how to prepare for IVF. And a lot of you think about, oh, IVF is a very difficult procedure. It's a 50% chance. Yes. Is it difficult? No. It's complicated? No. It's a lot of shenanigans and stress? No. But for you to get it right with IVF, you need to prepare for the procedure. And what are the things you need to do? What is even the IVF? In vitro fertilization. That's an artificial reproductive procedure that is done to help couples who have been trying to conceive to achieve conception and subsequent pregnancy and beautiful babies. So what do you need to do? One thing you need to do is a psychological preparation. You need to be psychologically ready, emotionally ready, you and your spouse. And if it's a single woman treatment, you on your own and your friends, your friends around you, those who are working with you on that journey, or the couple, the husband, the wife, and your team. I would say your team, that is those of you that will be working together to achieve this conception, your nurse, your doctor, and your environment generally. It's IVF is a journey from the point of thinking about it to planning for it, both financially, emotionally, socially, and psychologically. Now, socially, we wonder what concerns that with IVF? A lot of things. People bugging you, you're not pregnant yet. Oh, it's been 2 years, it's been 3 years. Let them breathe. Leave this couple alone. Leave madam alone. She's not ready, she's not ready. But when you're ready, you need to be ready for, you need to have a positive environment so that as you go through this procedure, you can actually cope. A lot of the success of IVF is actually saddled on having a healthy psychological and social well-being. The success of IVF is actually saddled around a healthy social, psychological well-being, the emotional well-being intact, as well as financially planning for the process. You plan to buy a car, you plan to build a house. You should also plan to have babies. Now, in terms of psychological, you need to be ready for the multiple appointments, multiple unnecessary questions. People that don't even matter would ask you, oh, why are you doing IVF? Oh, why are you doing this? Oh, do you mean this is wrong? Oh, it's not your fault. It's your husband's fault. It's your wife's fault. Do you even know that men and women contribute 30% equal percentage to the cause of infertility? And 30% also is caused by the husband and wife in combination. And then the other 10%, which will make it up to 100%, nobody knows why. It's what we call unexplained infertility. But the society would say, no, it is the woman. Why? Let the woman breathe. Now, all of these things are going to come up during your process of planning for your IVF process. Now, enough about the psychological, social, and financial preparation. Also, your body needs to be ready for the procedure. You need to change your diet, take a lot of water, more fruits and vegetables, enough supplements, particularly because you want to also have a healthy baby through the process. Taking your folic acid daily, depending on your weight and other conditions that you may have had before that process in terms of hypertension, diabetes, and all of that. The dose of your folic acid may range from 5 milligrams to 1 milligram. So it all depends on what your doctor says that you need. There are other antioxidants that would help to improve the environment, improve the environment of the eggs. People say, oh, when you take this supplement, the eggs will be better, there will be more. No, you really can't change the number of eggs you have because a woman is born with all the eggs she would ever have in her lifetime. But When you take this supplement, it improves the environment around the ovaries, within the ovaries, around the eggs, and such that when the eggs are collected during the process, which we'll be talking about in our next video. So stay tuned. And those eggs would be ready when they are collected. How are they when we take them? How healthy are they? This is what those supplements will do. Also, the sperm is not left out. Those antioxidants also improve the environment where the sperms are. Men are lucky, like they are always lucky when it comes to fertility treatment. Men can regenerate new sperms within 75 to 90 days. So when the new sperms are coming and the environment is right, you have better sperms, healthier sperms, completely healthy looking sperms. The motility, that is the way they move, the way they appear, everything would be better. So that's why you need to prepare for IVF. So it's not so much as your doctor rushing you or you rushing your doctor. I'm coming back today, I want my IVF tomorrow. No, we need to be ready. When you prepare well, by God's grace, you will succeed. So stay tuned on our next video. If you want to know more about IVF, fertility and all, please subscribe to our YouTube channel. Click on the notification buttons so you can get our new and latest videos. And if you have other topics you want us to talk about, please send your suggestions to our page and we will be ready to discuss explicitly all you want to know. For now, have a beautiful evening. Love you and have a good day. Bye for now.